everybody, this is Dr. Ramy Fahim from Ankle Foot Care Centers, talking to you today about foot sprains and how do we treat them, how do we recognize them, and how do we manage them. So first of all, what are foot sprains? This is actually a very common condition that we see in emergency rooms, and it usually involves a twisting type mechanism to the middle of the foot. So if you look at here, this portion of the foot model or the foot bones, we call this the midfoot area, and usually that's where we see most of our foot sprains per se. Things that you don't know, that a lot of people won't tell you about foot sprains. Number one, you could actually have a ligament tear with a foot sprain. Again, this is something that's very often missed in emergency rooms. And main ligament that supports this is called the Lisfranc ligament, and usually involves the base of the second metatarsal bone right here to the base of the first cuneiform bone. Those are bones in the midfoot. And then when we have a tear in this ligament, you can actually develop arthritis and chronic pain, and conditions that essentially continue to cause deterioration of the midfoot and foot function overall. Believe it or not, this is a condition if you are confirmed to have a Lisfranc injury, which was named after a French surgeon during the Napoleon Bonaparte era. This condition actually can be treated surgically. And it should be managed immediately because, again, if it's neglected, you will have a higher likelihood of developing what we call post-traumatic arthritis, and this is a very debilitating condition. Now, the key component in recognizing this is, like I said, early recognition and advanced imaging. Advanced imaging meaning using very key observation with X-rays, and in some cases CT scans or MRIs. The key component here is also a physical examination. A very thorough physical examination will help determine this. So if we stress the foot manually, meaning that we place the midfoot under tension, we can recognize if there is potential for ligament injuries in the foot sprain. Foot sprains actually do affect a lot of professional athletes, and unfortunately, they can actually potentially have an athlete gone for an entire season just because of a foot sprain injury like that. And like I mentioned before, oftentimes they are surgical problems. If you do suspect that you might have a foot sprain, or if you know somebody who might have a foot sprain, I highly suggest, number one, being seen immediately, and then to make an appointment to be seen at your earliest convenience. Thank you.